Hello, everyone. My name is Aileen, and I'm a family nurse practitioner student. And this is Eileen's Universe Nurse Vlog. This vlog is in response to the podcast, How the Bad Blood Started, Uncle Eddie. So here are my responses to the following questions. So the first question is: what are the problems or potential consequences of lack of health insurance? So, the first problem or potential consequences of lack of health insurance is individuals are more likely have less access to healthcare services. So, those individuals without health insurance usually face significant barriers to accessing healthcare services. They are more likely to postpone or forego necessary medical care due to cost concerns. This lack of access can lead to untreated health conditions, worsening overall health, and increased mortality rates. The second one is higher risk of preventive care deficiencies. So, again, these uninsured individuals are less likely to receive preventive care services such as vaccinations, screenings, and regular checkups. So, the absence of routine preventive care can result in late stage diagnosis of diseases that could have been managed or treated effectively if it was caught early. Um, and then the third is usually face higher financial problems and increasing medical debts. So when an uninsured individual finally try to seek medical care, they are often face high out of pocket costs that can lead to substantial medical debts. Uninsured patients typically pay for about probably 50 to 60% of their healthcare expenses out of pocket, so which can over time become unmanageable for those, especially for those who are low or moderate income individuals. So many uninsured individuals report having difficulty affording healthcare costs, typically will lead them to make sacrifices in other areas of their lives. The next is higher incidence of hospitalization and mortality rate or Debt. Um, Again, when these uninsured individuals do require hospitalization, they often receive fewer diagnostic and therapeutic services than compared to the insured individuals, contributing to higher mortality rates among the uninsured population. The next one is lack of continuity of care due to limited access to regular primary care providers. So, a lot of these uninsured individuals do not have a regular source of health care when they need it. So, this can complicate their ability to manage any chronic conditions that they have effectively or seek timely treatment for acute diseases. This lack of continuity of care can often lead to fragmented treatment approaches and poor overall health management. So, the second question is: have you ever witnessed or heard unintended patient consequences due to lack of health insurance? Explain. So, yes, I have witnessed one. I work at a oncology chemotherapy infusion clinic, and I had this situation one day where this particular patient was supposed to have his chemo infusion that day, but was not able to receive his treatment because first of all, he doesn't have any medical insurance or health insurance, and he was asked to pay 20% down payment of his treatment for that day out of pocket. So, according to the patient, he is not able to pay the 20% down payment because his credit card has maxed out. So, this patient just had a newly placed chest port access the day prior, and he came to that clinic that day to get his obviously get his chemo in treatment, and he was not able to do so because of um, lack of financial capability. So what happened that after that was the only treatment I was able to provide for that patient due to the policies and procedures of the organization was to clean out his newly placed port and put a new dressing in there. So that was the only treatment I was able to provide him that day. So what happened to this patient, I do not know, but of course, the consequence was he had a delayed treatment for his cancer. So this patient, um, I have not heard of anything about him the next day. So, of as we all know, cancer is a serious illness, and time is muscle when it comes to treatment and taking care of cancer. So his that day his treatment was delayed, and of course, um, often unfortunately the result of delayed treatment is poor health outcomes. So the third and last question is, why do you think the United States does not have universal health care? So I believe the United States does not have universal health care due to the following reasons. First of all, from a historical standpoint, the roots of divergence is traced back to the early 20th century when various proposals, such as the one from President Truman at that time for universal health insurance, was introduced but failed due to strong opposition from both political leaders and segments of the public. And also at that time, the establishment of employer sponsored insurance during World War II further entrenched a system where healthcare is often tied to employment rather than being viewed as a universal right. And another reason is a lot of economic arguments against universal healthcare often targets concerns about cost and taxation, such that implementing a universal system would require significant tax increases or could lead to inefficiencies within the healthcare sector. Also, the public perceived universal healthcare as a government run program. And for this reason, Americans are skeptic about the program to provide high quality of care or easily obtain access to care.